It's Chris Beyer.
Chris Bowling.
Hey, CB. We're in focus today with Debbie Healy from Rock Valley Physical Therapy. Welcome, Debbie. Great to have you.
Yeah,
It's good to be here. Thank you.
So let's talk a little bit about your background with Rock Valley, and then we'll talk a little bit about Rock Valley and some milestone year for the organization. But who are you and what's your background? What do you do for Rock Valley PT?
Oh, sure. My name is Debbie Healy. I'm a physical therapist. Graduated from St. Ambrose University about 21 years ago. Been with Rock Valley for about 12 years of my total career, and I'm the Vice President of Growth and Development here.
Very good. Very good. And I think like a lot of the Rock Valley team started as a PT, not just coming into the organization for that specific role. That seems to be a hallmark kind of what we've seen from the organization.
Yeah.
So when you think of Rock Valley Physical Therapy, you just have celebrated your 40th anniversary. If you've been there for those 12 years, if you look at what you're celebrating, how is Rock Valley helping members, the community? I mean, what are you doing that's unique especially for the patients that you serve?
Yeah, that's a good question. We have a few different core competencies that we focus on. So we offer PT, OT, and speech services. We also have a wellness team, and we provide athletic training services. Within our wellness division, you guys, I think, are going to have the opportunity to meet with Ken Asta
Yes.
in a future date, and he's our Director of Employer Services. So we have some functions that we work with employers in our community, and we offer pre-employment screening, on-site ergonomic assessments, on-site evaluations and treatments, and we try to do these things to keep these individuals healthy before they sustain an injury. And if they do sustain an injury, we try to make it as easy as possible to be seen in our clinics. And that's kind of our employer services division. But there's a lot of great things that we're offering for patient care in our communities. We have basic musculoskeletal assessments that we can do in our clinic.
Right.
We offer niche practices like pelvic health and vestibular and TMD disorders. Just a lot of really great things that we're doing to actually treat patients and take care of them. If I think about what we're doing for our own employees and for our communities, though, I think that extends even beyond what we just talked about. We're going through a trauma-informed care learning modules with our staff, which just means we're really devoted to taking care of mental health and determining what our role is within that.
Awesome.
We have a philanthropy team that this year, in celebration of our 40-year anniversary, we're donating $1,000 to over 40 different organizations across our communities. And last year we raised about $70,000 for Make-A-Wish. So there's a lot of really neat things that Rock Valley is trying to do to make our communities a better place to live and work.
That's awesome. Well, I know in my former athletic days, I went to Rock Valley for the injuries. I mean, that was it. When you talk about all the things that you've expanded, you think about just trying to stay healthy and well, not only when you have the injury happen. That's a big expansion for you. And you've expanded in market too. I mean, it was Quad Cities, now across central Illinois, all the way through Iowa into Nebraska, right? I mean, you've grown significantly probably from the time you've been there.
We have. So our first location was here in Moline, Illinois, back in 1984. And right now we have just shy of 63 locations in Illinois, Iowa, and Nebraska. Our hope is that in the next 3 to 5 years, we're at about 80 locations and about 700 employees, still staying Midwest and therapist-led and employee-owned. So.
Well, that was going to be the question too, is what you see for the future. I think as you started to understand how to acquire, how to grow in new markets, that probably makes it easier to understand expansion where, you've got some momentum going.
Yeah, for sure. I think what's important is that we look at new markets where we can open locations where there's a community need, but also making sure that our clinics that have been open for a few years and beyond are still continuing to grow in their communities. And then lastly, hopeful that we can continue with some really successful mergers and acquisitions where people seek out Rock Valley and just say like, hey, I'm tired of the administrative burden. I'd love to join forces and just be able to take really good care of my family and my coworkers and the patients in my community.
Yeah. And that's the perfect reason to join. It helps them to join a culture like Rock Valley, which is awesome to see. I know,
Yeah.
Chris, as we're coming up on time with Debbie, you've got your question you like to ask as we finish up.
My one question through life, through work, good days, bad days. Do you have a motto? Do you have a quote, Debbie, that kind of gets you through those days?
Yeah. So it's interesting. I'm actually going to share the motto or the quote that we use at Rock Valley, and we really pride ourselves on collaboration, and this means collaboration with our coworkers, collaboration with physicians, dietitians, anyone that might be active in improving the patient's lifestyle. And we say here, we'll get you better. We'll find someone who can.
Yeah. That's great. Yeah. Just making the connections for what's there, because you're taking care of people. I love that.
I can
go ahead, Chris.
Certainly vouch for that. I've been a frequent flyer, elbow surgery, back issues, and you guys are just amazing. So cannot say enough.
That's great.
Good things about the organization.
Absolutely.
Well, wonderful.
Well, Debbie, thanks for joining us in Focus. Enjoyed the chance to talk with you, get to know you a little bit more, and learn about Rock Valley's history. Congrats on 40th.
Thank you. Thanks for having me.
Thanks so much.